What if the very medical tests designed to keep you healthy are actually putting you at risk? It's a conversation most physicians won't have with their patients, but emerging research suggests that certain routine screenings may cause more problems than they solve for adults over 70. Recent medical studies indicate that nearly 40% of standard tests performed on seniors result in treatments that weren't necessary, leading to complications that could have been avoided entirely. Even more concerning, the vast majority of older adults remain unaware that they might be receiving excessive medical testing. Today, we're examining 5 commonly recommended medical screenings that might be doing more harm than good for those in their golden years. These findings are based on peer reviewed research, yet they're rarely discussed in typical medical consultations. What's your experience with medical testing? Have you ever questioned whether a recommended procedure was truly necessary? Drop your thoughts in the comments below, and don't forget to subscribe for more health insights tailored specifically for seniors. Let's start with bone density screenings. The DEXA scan appears straightforward enough, a simple, painless procedure that evaluates bone strength to assess fracture risk. However, for individuals over 70, these scans frequently generate unnecessary anxiety rather than meaningful health benefits. The fundamental issue lies in how we interpret the results. As we age, some degree of bone density reduction is completely normal. It's as natural as developing wrinkles or gray hair. Yet many seniors find themselves prescribed powerful medications like bisphosphonates after receiving results that show perfectly age-appropriate bone changes. These medications, while designed to strengthen bones, can cause severe complications, including jawbone deterioration and digestive problems. Research published in geriatric medicine journals tracked over 1,000 women above age 70 and discovered that bone strengthening drugs reduced fracture risk by less than 0.5% over 5 years. Meanwhile, the women taking these medications experienced significantly higher rates of side effects, including severe heartburn, jaw pain, and unusual bone breaks. Consider the story of Margaret, a 78-year-old former librarian who had never experienced a fall or bone injury. Her routine screening revealed mild bone thinning, which is typical for her age group. Her physician immediately started her on medication. Within months, she developed painful jaw symptoms and acid reflux, so severe she couldn't enjoy her morning coffee. After discontinuing the medication and focusing on weight-bearing exercises, proper nutrition, and vitamin D supplementation, she remained fracture-free and returned to her daily walks without any bone-related concerns. For most people over 70 who aren't experiencing falls or fractures, lifestyle interventions like strength training, balance work, and adequate nutrition have proven far more effective than medications, reducing fracture risk by over 20% according to recent osteoporosis research. Moving on to brain imaging for memory concerns. When older adults notice increased forgetfulness, the natural response is often fear of dementia or Alzheimer's disease. Doctors frequently order MRI scans to investigate these concerns, but these detailed brain images rarely provide the reassurance patients seek. In fact, most brain scans in people over 70 simply reveal normal age-related changes, such as minor shrinkage or small spots that are completely typical in older brains. The problem arises when these normal findings trigger a cascade of worry, additional testing, and sometimes even surgical procedures that don't improve memory and may actually cause harm. A comprehensive study examining over 3,000 MRI scans in adults aged 70 to 85 with mild memory complaints found that 86% showed some type of brain abnormality, but only 3% of those findings represented conditions that could actually be treated. This means 97% of people endured the emotional stress of learning about supposed brain problems when nothing was actually wrong. Even worse, about 12% were referred for invasive procedures like spinal taps or brain biopsies based on these vague scan results. Take Robert, a 72-year-old retired accountant who became concerned about occasionally forgetting names or misplacing his reading glasses. His doctor ordered a brain MRI that showed white matter changes, which are completely normal for his age. He became convinced he was developing dementia and stopped participating in activities he enjoyed, including his weekly chess games and volunteer work. His anxiety about the scan results actually worsened his memory problems. However, when he underwent simple cognitive testing, his scores were well within normal ranges for his age group. Once he understood that his MRI findings were age appropriate, and with some focus on better sleep habits and regular mental stimulation, his memory concerns resolved and he returned to his normal activities. We'd love to hear about your experiences with medical testing. Have you ever had a test result that caused more worry than benefit? Share your story in the comments and subscribe to our channel for more important health information designed specifically for seniors. Next, let's discuss cardiac stress testing. This common procedure, which monitors your heart while you exercise on a treadmill or receive medication that simulates physical activity, is frequently ordered for seniors who mention mild fatigue, occasional chest tightness, or simply not feeling as energetic as they used to. While stress tests are designed to detect blocked heart arteries, they often create more problems than they solve for people over 70, particularly those without clear signs of heart disease. The main issue is accuracy. Research shows that in adults over 70, stress tests incorrectly suggest heart problems up to 40% of the time when no real problem exists. These false alarms lead to follow-up procedures like heart catheterizations and unnecessary stent placements or bypass surgeries. A major cardiology study found that more than half of all stents placed after stress test referrals were performed on patients who had no real symptoms or benefit from the procedure. These patients showed no improvement in survival or quality of life after their procedures, but they did experience higher rates of bleeding, kidney damage from contrast materials, and extended hospital stays. This happened to Frank, a 77-year-old former mail carrier who maintained his fitness by walking several miles daily. During a routine checkup, he mentioned feeling slightly more tired when walking uphill. His doctor scheduled a stress test as a precaution. The results were inconclusive, leading to a heart catheterization procedure where a small narrowing was discovered and a stent was inserted. That evening, Frank experienced a severe reaction to the contrast dye used during the procedure and developed kidney complications. He spent over a week in the hospital and required ongoing medical care for months afterward. His original fatigue symptoms never improved because they weren't related to his heart. He simply needed better hydration and more rest between activities. If you're over 70 and not experiencing classic heart symptoms like chest pain during physical activity, significant shortness of breath, or dramatic drops in energy during light exercise, a stress test may cause more harm than good. Safer alternatives include a resting electrocardiogram, which evaluates heart rhythm while you're at rest, or a coronary calcium scan, which uses minimal radiation to check for dangerous plaque buildup in heart arteries. Now for a screening you probably didn't expect to see on this list: colonoscopy. This procedure, which uses a flexible camera to examine your colon, isn't always the best choice after age 70 and is rarely recommended after 75 unless you're experiencing specific symptoms. The risks increase significantly with age. The preparation process involves powerful laxatives that can cause dehydration, dizziness, and kidney problems in older adults. The sedation required during the procedure poses additional risks to brain function in seniors. Perhaps most surprisingly, the examination itself can cause serious complications, including bleeding, colon tears, and heart rhythm problems during sedation. A comprehensive study following over 1.3 million Medicare patients aged 70 and older found that for every 1,000 colonoscopies performed in people over 75, only 2 lives were saved, while more than 20 people experienced serious complications. That represents a 10-to-1 risk-to-benefit ratio. Even when polyps are discovered during these procedures, many are small and slow-growing. Removing them in older adults sometimes causes more harm than leaving them alone. Consider Helen, a 74-year-old grandmother who helped run her family's restaurant. She had no symptoms, no unusual bleeding, no changes in bowel habits, and no family history of colon cancer. Her new doctor, recently out of medical training, strongly urged her to undergo screening colonoscopy. She agreed to the procedure. During the examination, a small polyp was removed and she was sent home. That night, she experienced severe abdominal pain and lost consciousness. At the emergency room, doctors discovered a bowel perforation requiring emergency surgery. She spent 9 days recovering, lost significant weight, and never fully returned to her previous level of activity. A review of her medical history revealed she had already undergone 2 normal colonoscopies in previous years, making this latest procedure completely unnecessary. Current medical guidelines recommend stopping routine colon cancer screening at age 75 for most people. For those in excellent health, stool-based tests like the FIT test, which can be completed at home without preparation or sedation, often provide a safer screening option while still detecting most concerning cases. What are your thoughts on these screening recommendations? Have you had similar experiences with medical procedures? Let us know in the comments below, and make sure to subscribe for more health content specifically designed for the over 65 community. Finally, we reach the most overused and potentially dangerous screening for seniors, one that you've very likely encountered. Annual full-body CT scans are sometimes offered as part of executive health packages or promoted as preventive services at private medical clinics. They're marketed as a way to detect cancer early, but the reality is far more concerning. These scans expose your body to extremely high doses of ionizing radiation. For older adults, especially those over 70, the likelihood of triggering unnecessary follow-up procedures, biopsies, and surgeries is remarkably high. The irony is that there's absolutely no evidence that full-body scans performed on people without symptoms actually save lives. Each scan delivers radiation equivalent to approximately 500 chest X-rays. According to recent modeling research, the dramatic increase in CT scanning across the United States may now be responsible for up to 5% of all cancer cases, making these scans as significant a cancer risk factor as daily alcohol consumption. This means 1 out of every 20 cancers could potentially be caused by a scan that was supposed to prevent disease. The scans frequently detect harmless nodules, calcium deposits, and cysts that are simply normal parts of aging. However, once these findings appear on the scan, they trigger alarm bells. More scans follow, then biopsies, then anxiety and panic. Let me share the experience of William, an active 82-year-old who continued teaching self-defense classes to other seniors. He felt wonderful and participated in a comprehensive health screening at an upscale medical facility. His full-body scan revealed a tiny 3-millimeter lung nodule. This discovery initiated a chain reaction of medical interventions. He was referred to cancer specialists, underwent additional PET scans, and eventually had a needle biopsy performed. The final result showed the nodule was completely benign. However, the biopsy procedure caused part of his lung to collapse, requiring emergency hospitalization and a 2-month recovery period. All of this medical intervention was performed on something that should have been left alone. Medical experts now strongly advise against using full-body CT scans for general screening in people without symptoms. The American College of Radiology has stated clearly that there's no proven benefit and significant potential for harm from these procedures. If you're experiencing specific symptoms like unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging makes perfect sense. However, scanning the entire body without focus is like searching for buried treasure with a metal detector in a minefield. You might find something, but the damage could be far worse than what you were trying to avoid. A safer and smarter approach involves listening to your body. If you feel well, maintain regular checkups with your primary physician and only pursue tests that are clearly indicated for your specific situation. Your time, energy, and health are far too valuable to waste on fear-driven screening procedures that could leave you worse off than when you started. So, there you have it, 5 medical screenings that may appear helpful but can actually cause harm, particularly once you're past age 70. Modern medicine offers incredible capabilities, but it's not infallible. Sometimes doing less is actually doing more for your health. Always ask your doctor what happens next if a test discovers something concerning. If the answer is unclear or if the risks outweigh the potential benefits, it may be time to pause and reconsider. Remember that genuine prevention begins with lifestyle choices. Stay physically active, eat nutritious foods, get quality sleep, and choose your medical screenings wisely. We're eager to hear from you. Have you or someone close to you ever experienced complications from a medical test or treatment that turned out to be unnecessary? What was your experience like? Please share your stories and opinions in the comments section below. We read every comment and love hearing from our community. Thanks for watching, and don't forget to subscribe for more content like this.